I volunteered between my ninth grade and 10th grade year to be a candy striper back in the days when candy stripers wore the red and white pinstripe dresses. From that time on, I just knew that I wanted to be able to help the patients.
What are your thoughts on, in terms of the appreciation that nurses get?
I never did it for appreciation or recognition. Really, the satisfaction came from when you watched a patient come in really sick and then seeing them get better. So I remember getting a letter in the mail about, look at the Air Force, and in 4 years you'll be making $33,000 a year, which I thought was great.
I just want to say it's such an honorable job to be able to serve your country, and I think it's one of the most special things you can do.
Where it really became real is when you were seeing people come into the emergency room because they had a gunshot wound or because they stepped on an IED. When you're in the military, it's not that you join the military to fight.
Mhm.
You're really doing it to protect the country, and you're hoping that our strength deters war.
You led some of the largest units in the Air Force Medical Service, including a level 1 trauma center. So I was wondering, do you ever miss that phase of your life?
I think when you leave one job and you go into another, the one thing that you really miss are the people that you've worked with along the way. Sounds
I'm
good.
thrilled to introduce Schmidt, a distinguished healthcare leader whose career spans from hands-on patient care to high-level military healthcare management. So thank you, Lisa, for being here and taking the time to speak with me.
Thank you for inviting me.
Yeah. So I first wanted to start by talking about your experiences with nursing. I was wondering what initially drew you to nursing? When did you start? And what were your early experiences like in this field?
I actually got started in nursing, or my interest in nursing, when I was in high school at ninth grade. I volunteered between my ninth grade and 10th grade year to be a candy striper back in the days when candy stripers wore the red and white pinstripe dresses. And so volunteered on an inpatient unit during that summer. My dad would drop me off in the morning when he went to work and pick me up on the way home. And so from that time on, I just knew that I wanted to be able to help the patients. And so that got me started. And then I went into nursing. And in the early days, it was a lot less technology than what you see today. That's probably one of the major differences.
Hmm. I'm not sure what is a candy striper? I've never heard that term before.
Uh, uh, yeah, a candy striper back in the day were volunteers that would provide support to patients, maybe take them, maybe just sit and talk to patients, maybe take them some food or drinks if they wanted, like if they wanted some coffee, you'd go get them coffee, or maybe it was also helping the nurses if they needed some help. So it was just helping out on an inpatient unit wherever they needed help.
Yeah, that makes sense. We still have similar volunteer positions where I,
Exactly. Back in the day, they were called candy stripers because they all wore red and white
Mhm.
pinstripe dresses so that you knew
Yeah,
they were the volunteers.
yeah. Okay. And what are the biggest problems do you think nurses face in healthcare?
I think one of the challenges, and it comes around, I've seen it go quite a few times, is staffing. Staffing is always a challenge, whether it's turnover or demand. And as you get lower in staffing, it causes more stress on the nurses that are there, which then causes more turnover. And I think staffing has always been a challenge, and keeping it units or clinics fully staffed is really difficult. Sometimes you might only have one or two nurses, and if you lose one, you're down to 50%. And
Hmm.
so I think that's one of the challenges. And I think in healthcare in general, one of the challenges is keeping up with technology.
Yeah.
The technology changes constantly, and because of all the HIPAA requirements and security requirements, when you implement new programs, it takes you don't just turn it on. There's a lot of trial, and so it doesn't turn over as fast as what the technology turns over. And so I think that's always a challenge. And then also with everything becoming electronic, your medical records, the doctor's orders, if you have issues like when there was the viruses or the servers go down, then as a nurse, I can't see the orders that the doctor wrote, or I don't have a place to document. So you always have to have those backups. which are always a challenge, especially when you have to do it when it's unplanned.
Mm-hmm. Yeah, that makes sense. I was also wondering, what are your thoughts on in terms of the appreciation that nurses get? Do you think they're appreciated enough for the work they do, or are they a lot undervalued in the hospital setting?
In the hospital setting, I think a lot of times they're taken for granted.
Yeah.
They're just there, you're just you're a little bit of everything. You're doing medications, so you're working with the pharmacy, and you're drawing labs, and so you're working with the lab, and you're working with the caregivers or the family members and the patients and radiology. And so you're working with everybody, and then you've got the doctors in every different specialty. And
Hmm.
I think you're just kind of that you're trying to always quarterback for what's best for the patient. And so sometimes I think probably more taken for granted than not appreciated,
Hmm.
because you're just there.
Hmm.
Um, but I know for myself, I wasn't always doing it. I never did it for appreciation or recognition. Really, the satisfaction came from when you watched a patient come in really sick and then seeing them get better, or maybe taking the first step or getting off the ventilator, and so those were always the things that were more rewarding to me versus getting those external rewards.
Of course, yes. And it always is nice to feel like you're valued in your workplace setting. And so I'm glad that you still got that sense of satisfaction from caring for your patients, which is what the first priority should be.
Right.
So, how did you then shift from nursing to from traditional nursing to then joining the Air Force, as I believe you joined first as a consultant to the Air Force Surgeon General. Was there something that came before that, or was that the next step after nursing?
It was more like a journey. So
Mhm.
I
Okay.
was in the hospital setting, working on an open heart unit, and it was you're just doing the inpatient day in, day out. And so I was ready for another challenge. And so I remember getting a letter in the mail about, look at the Air Force, and in 4 years, you'll be making $33,000 a year, which I thought was great because at the time we were making $9 an hour
Hmm.
with a bachelor's degree coming out of college, as a registered nurse. And so I thought, oh, well, let's go look at it. And when I went to look at that first base and to see the care they were given, I think the first thing that struck me was patient care was patient care. And there was not a lot of difference in how that care was delivered. And so that was very appealing to me. And the other thing that I found appealing was the opportunities. One, you could serve your country. Two, there was growth opportunity, because every 2 to 3 years you move on to another job. And usually when they're moving you, it's to a next level. So
Hmm.
you really get a good foundation and then you move to another level. And so I found that. And at the same time, I could see literally the world.
Yeah.
And so it was just an opportunity. I thought, hey, I made it through 4 years of college. Let's see what 4 years of the Air Force can do. And so it was just for actually, it was an initial 3-year commitment. And I
Hmm.
thought, let's just go and see what happens. And from there on, I was hooked. And the longer you stayed in, the more and more patriotic. At first, it was a job, and then it turned to more um, patriot patriotism and how you're taking care of not just the active duty members that are deploying, but also their family members. Because if you're in another country fighting a war and your family's back home and your kids, um, if you're worried about the kids, then you can't be all in over fighting the good fight. And so it was really making sure that you were taking care of both. And so I found that very interesting. And so when I first came in, I was working in a hospital on a unit, did that for 3 years, and then deployed to Desert Storm, went
Hmm.
to England, and was at an inpatient unit there when that first went off. And so I got to go to England, which was probably not a bad assignment, but we were working 6 days on, one day off,
Hmm.
12-hour shifts, not a lot of patients because we were waiting for the war to start.
Yeah.
And then from there, I went to another inpatient, larger hospital. But at that time, then I was given the opportunity to work in health promotion. where I was really looking at our active duty military members' health and fitness,
Hmm.
tobacco use, fitness, weight management. Like, how do you keep people healthy so that when they deploy, we don't have to bring them back for a heart attack? And so
Yeah.
I got started in that. And then from there, I got another job at it was a base, but also a headquarters. I was kind of consulting to the headquarters at that time. And then from there, I went to a larger headquarters where we were over 11 bases. And
Hmm.
then from there, that's when I got to the Surgeon General's office. So it was more of a progression
Hmm.
as I went through my career. So I think it's really good for people to have that foundation and then kind of build on it. And then it kind of led to getting to the Surgeon General's office. I've actually stationed at the Surgeon General's office twice, once in Washington, D.C., and then once we had a policy branch down in San Antonio. And so then later in my career, I went back there working on policy.
Yeah, and this was prepping for the US war in Afghanistan, right?
When I went to Afghanistan, actually, after I was in the Surgeon General's office, I went to a base,
Yeah.
um, and I was a healthcare integrator overseeing the population health, which is a lot of the clinical preventive services.
Hmm.
And then I went into the chief nursing position, and then I was a squadron commander. And so as a squadron commander, I was over all the clinic operations in that hospital. So if you think family practice, pediatrics, radiology, physical therapy, where you're overseeing those operations, that's when I had the opportunity to deploy to Afghanistan.
Okay.
And and then when I was in Afghanistan, again, I was the squadron commander over those operations, the emergency room, the operating room, the intensive care, the family practice clinic, all of those day-to-day operations.
Okay. Yeah, I just want to say it's such an honorable job to be able to serve your country. And I think it's one of the most special things you can do. Not just being in healthcare, but also being in healthcare and serving your country is just a double win. But next question I wanted to ask was, when you joined the Air Force, what were some of the biggest adjustments or surprises you faced compared to civilian healthcare? Were there any differences at all?
There were some differences, because when you come in the military, you have rank. And
Mm-hmm.
so as a nurse, as a registered nurse with a bachelor's degree, you come in as a commissioned officer. And so you have authority just by your rank. And so you're over the enlisted, and even as you go more senior,
Mm-hmm.
your rank can be more senior than maybe a physician. And so then from a military perspective, um, it's more of a leadership development. So you kind of go through the ranks. So getting used to that rank structure, I think, was a little different. But the clinical care, I think, was very similar. Um, and a lot of times we benchmarked our care off of national organizations like Mayo Clinic, Johns Hopkins, Cleveland Clinic, and we would be following what they were doing, what they were recommending. And then there's many things that the military did that became standard in the civilian hospitals. You know, some of your practices when you're deployed, maybe like wound care, like you think wound vacs and some of those things. A lot of those things were first introduced like in war-like settings. And
Mm-hmm.
so in some ways you set the standard. And so that was one change. The other change is the uniforms. You just have to wear the same uniform every day. But then
Yeah.
the flip was the same when you're retiring from the military and you're coming back to civilian, you're like, oh, now I got to figure out what to wear every day. So it was a little both the of so I think the uniform and the rank structure is probably the biggest difference.
Yeah. Yeah, it's good that you don't have to decide what I have to wear every day. Just same thing every day.
Yep.
But you sort of touched on this, but how did your roles and responsibilities evolve as you progressed within the Air Force? You were talking about how there's a rank system. So how did you kind of go up the rank system and then how did those responsibilities change?
Yeah, in the military, it's pretty structured where you know what gateways you need to get to the next level. So one is time. You just need experience. So you start off with your clinical experience, getting that experience in the junior ranks.
Hmm.
But then there's also professional military education. And at each level, there would be some education that you would have to do to get to the next level. And so when you're going from like major to lieutenant colonel, you have to complete Air Command and Staff College, which is an 18-month, I did it by correspondence course. Some people go in residence, and if you go in residence, it's a 1-year course, and that's your full-time job. And then to get to colonel, you have to go through Air War College, which is again a 18-month by correspondence. So I did it by correspondence, and then I got selected to go in residence. And there's only 3 nurses a year selected to go in residence because
Hmm.
they pick people from all the different career fields to
Yeah.
go for that year. And then you're just really studying really about the strategic studies. It's a much more strategic level to go into that. And so as you go through the different ranks, you're starting out at a very tactical level, just doing the day-to-day job, following what you would do in a regular hospital. But then
Hmm.
as you get into that middle operational, you're managing a little bit more, maybe managing the unit. Um, and then as you go into those senior ranks, you're becoming much more strategic, where you're looking at the vision, direction, overall for all of your staff.
Okay.
And so the Air
Yeah.
Force is very deliberate about giving assignments. So you might start off at a small clinic or a small hospital, going to a larger one, going to a headquarters, but then going back to maybe a clinic in a leadership position, and
Hmm.
then taking that experience and going back to maybe a headquarters at a higher level, so that you're always having that experience and not forgetting where you came from, so that you can apply it as you get to that higher level.
Yeah, that's a good system. And I was wondering what that air war school was you had on your LinkedIn. I think you went to Japan or East Asia, somewhere there.
Yeah. So while I was at Air War College, if you think of getting your master's degree, and you actually get a master's degree out of Air War College,
Hmm.
um, and strategic studies. So if you think of a traditional going to college and you take like maybe a history class or something that's 3 credits. So you really look at the history of war, and so that might be a 3 credit class. And we had one 3 credit class on process improvement, or just operations in general. And so there were different studies, just regular 3 credit classes. One of those 3 credit classes was a regional study. So you study a region of the world, and you're looking at their strategic, their operational, their financial, their political, their culture.
Hmm.
And then so you study about that for that semester. And then after that semester, the culmination of the class is you actually go to those countries and you meet with their military, you meet with their political. And so my regional study was on the Far East. And so we were able to go to Taiwan, Korea, and Japan and actually see firsthand, and meet with some of their operations, their attaches. And so it was getting really that firsthand knowledge and seeing all of that. So some of it, like the cultural, when we'd go to Japan, we got to meet with their military and our counterparts in their military.
Hmm.
And then we would go to Hiroshima to see kind of the culture there, and some of um the area. And so you really got immersed into that area. So it was a
Yeah,
great year.
that seems like a wonderful experience, getting to travel, see different cultures and experiences that other people in different countries have. Um, but you started with working in patient care, but then you sort of shifted to healthcare management.
Mhm.
So how did that shift start from patient care to then managing healthcare professionals instead?
Yeah, and I think that goes back to those changes in rank as you go
Hmm.
through. And so you start getting a little more responsibility, and then you get a little bit more. And so it was more of a gradual experience for me, where when I was doing the health promotion program at one of my bases, starting to work both with patients, but then also with leadership. Because if you're going to help people with fitness or weight management, you also have to look at your policies, and so the Air Force has fitness standards. And so you had to make sure that you had the policies that reinforced it. And so I was kind of working in both for a while. And so I would say it was more gradual and it was based on each of those different assignments where it went more from doing direct patient care to kind of doing both to then just being more in that leadership role.
Yeah. And I was very curious from the first time I read that you were in the Air Force and that you were deployed to Afghanistan. The first question I really had was, what was it like being in Afghanistan? What was the environment like, the conditions you worked under? Was it dangerous? How did you feel when you were working there? I just want to know more about that.
Yeah, I think when you first find out you're going to Afghanistan, it's like, oh my gosh, like, and then one of the doctors I worked with who had just come back, he said, Lisa, there's more people killed on our roads than that are killed over there, so you kind of put it in perspective, right? And
Hmm.
you're like, okay, I can do this, because there's a little bit of fear of going, oh my
Yeah.
gosh, I'm going into a war zone. And then you get there and you have a very heightened sense of awareness, little noises, or you hear them doing chants, or, and you're like, oh my gosh, what's happening? And so, the first couple of weeks, it is a little anxiety inducing, and when you land there, you fly in at night because you want to fly in undercover
Hmm.
and they do what's called a combat landing. And so you fly in and then they do a real fast dive down because you want to be high enough that if they're shooting anything, it's not going to hit you. And so
Yeah.
you want to you get over the base before you land. So they go over and down. And
Oh
so
my
you're
God.
like, oh, so you're going all lights off because they turn all the lights off because you don't want to be seen. So that's kind of your first awakening to, oh my gosh, I'm in a combat zone.
Yeah.
And then there's wires all around. Like you've got the chain link fence that's like 16 feet high with a barbed wire on it, but you can see outside.
Hmm.
Um, but now that because I was there in 2007, 2008, and so it was still earlier on in the war. Later they came back and they did put cement walls up so you couldn't see in and out, but you were very well aware that there was a war around. And when planes would fly, you could see their flares going off, like their anti-fire, so you knew that they were firing close enough to you.
Yeah.
Um, but I was at Bagram, so it was a larger base. Uh, but it was interesting. And most of the patients you saw, you would see patients for regular primary care, backache, cough, cold, flu, but where it really became real is when you were seeing people come into the emergency room because they had a gunshot wound or because they stepped on an IED or they were in some kind of explosion. That's when you really knew you were in a war zone and taking care of the patients. And then I would say when patients like that would come in or soldiers, uh, their unit also had a liaison there. And as soon as that patient came in, that liaison was talking to the unit back home, making sure the family was aware. And sometimes I think that was one of the biggest things that I remember is we had one patient come in that was very critical and knew he probably would not survive his injuries. Um, but everybody, every physician, everybody there pulled together to, we had to get like 60 units of blood. So a call goes out for anybody who can donate to bring their, come in and have blood drawn so we could take it from one person and put it right into the patient
Hmm.
just to help him survive. And the doctor slept by his bedside overnight to help him survive till we could get him flown up to Germany. And at the same time, they were flying his family to Germany so that so that the family could see him before he passed while he was still alive. And I think that let me know how much really we had to support the people both that were injured and their family members.
Hmm. Yeah, I think war isn't very imaginable for people in America, I feel specifically because we're so separated from that world. I think there's a separation. There's the Western world and the Eastern world. And when you think about wars, most of the wars are kind of fought abroad. I think all of them. So I think it's very hard for citizens in America who are not in that setting to understand what's that like. And yeah, that was actually going to be my next question, what it is like to provide care in a military setting in combat zones. How close are you to those combat zones, or is that air base pretty far off? Were you ever in danger?
Well, when I came back, I told people, you really don't see it. And the day I sent some troops off, that very day, there was actually a rocket that came into the base and hit our laundry facility. And so you think you're safe, but you never know because there's those things that can happen. We do everything to protect the base,
Mm-hmm.
but there's still a war, and it was probably an 8-mile perimeter around the base. I don't know, it was a pretty big area, but in relation to the war going around the whole country, we were just one little pocket.
Mm-hmm.
And so you're walled off, but there's still a war all around you. And sometimes you could hear an explosion, and it might have been a mine that went off because either somebody stepped on it or they detonated it, and you could hear them. And so it was very real. And then we also had forward operating bases, which were just, if you think of MASH, little small tent places where they would treat the patients just to stabilize, and then they'd airlift them into Bagram, where we had the level 1 trauma to stabilize or to provide more definitive care. And so those patients would come in, and we would usually get notified that they were bringing those patients in. And so we would have the emergency room set up for all of those patients so that as soon as they got there, we were taking care of them. And so it was all hands on deck. And unlike a regular hospital, our doctors stayed there 24/7 the whole time they were deployed. They didn't even go to the chow hall. People brought them back food, or the nutritional medicine would prepare their meal, and they slept there, they ate there. They were 100% dedicated to taking care of those patients.
Mm-hmm. Yeah, and there are those moral rules that people need to have, that you should, even if there's a war, that you shouldn't attack anyone who's already hurt or getting medical care or anything like that. But then there's that saying, all's fair in love and war.
More,
So it's still such a dangerous setting to be in.
yeah.
Um, yeah. So were there any memorable or challenging experiences from your time in the Air Force that really tested your skills or pushed you out of your comfort zone?
Um, I think there was always growth, and every time you go through that growth, it's always pushing you a little bit more. Um, Trying to think what a good example would be. I I think probably one of the biggest challenge when I did go to Afghanistan, that was a big challenge. And
Mm-hmm.
even going to Air War College, it was very strategic on war. And
Yeah.
I'm a nurse, like, so that was a whole new environment for me. And so it was really eye-opening to learn about the strategies, because when you're in the military, it's not that you join the military to fight.
Mm-hmm.
You're really doing it to protect the country, and you're hoping that our strength deters wars and deters the fighting. And I think as I went through that, it was more of a growth process. Um, and so I think that was probably, I don't know about a challenge. There's always challenges,
Yeah.
like just running the mile and a half used to be
Mm-hmm.
like, oh my gosh, I got to run a mile and a half and be timed. Like I don't mind doing exercise, but I don't want to be timed doing it, and then I ended up running the fitness program,
Uh-huh.
and really learning more about the why. And I think that was probably one of the greatest challenges, was when I was in the Surgeon General's office, and we were changing our fitness program from, we were doing a bicycle test, going from that to a run, and doing the policy and knowing where those standards should be, how to coordinate that and then get that out to everybody in the Air Force so they understood what they were going to be tested on, what the standards were. And then we coordinated with all the different organizations like the Cooper Clinic. Where should that fitness standard? And it was really a fitness standard based on the health requirements.
Mm-hmm.
And where should those cut lines be? And then how do you change people's behavior that maybe they don't like to exercise to motivate them and to support them and to help them make those healthy changes? And so doing that whole policy, there were many a nights, and then we had to get it out by December 31st that year, and it was June. And so we had about 6 months to get a whole policy coordinated. And everybody knew when you were up there, if you could get up one policy out in 3 years, you were doing good. And we were like, we have 6 months. And so there
Mm-hmm.
were many late nights that we would sit and just be going through the policy to make sure that it was something that we could implement across the Air Force.
Yeah, and you led some of the largest units in the Air Force Medical Service, including a level one trauma center. So, how do you exactly manage and lead so many people and also make clear, effective decisions in such high stress environments?
Yeah, I think as you go through that growth process and you've been at every one of those levels,
Mm-hmm.
um, when I got to that level, the three squadrons that I had, um, they were, you have to have good people working under you. And so I think one, you make sure that those people are trained and equipped to provide the support to their people.
Yeah.
Two, you've got to trust them. And then three, I think you have to be open to allowing them to come to you when they need something, because you can't be everywhere. And
Mm.
so you're really making sure that they have the resources and the training that they need, and then they're doing the same for their downlines.
Yeah.
And so then you might have 5 or 6 people that are running different areas. So there was those three big squadrons, but then I also had an administrator that worked for me. I also had a chief nurse that worked for me. And so you have those other roles, and you have to rely on them and trust them.
Mm-hmm. Yeah. And so, how did your experiences in Afghanistan and being in the Air Force Medical Service then influence your perspective on nursing and healthcare management? And what lessons did you bring back from this experience?
Oh, lots of lessons, because every day you're learning something, right? I think as I transitioned out of the Air Force and came back into civilian nursing and actually civilian healthcare,
Mm-hmm.
because now I'm in a job where we're running clinics focusing on, primary care. Um, I think the lessons that I learned, um, really, and you're saying specifically for the lessons from Afghanistan, and I don't know as much that Afghanistan was just like 4 months, so you have
Yeah.
26 years, that was 4 months. So that was just one little piece. I
Mm-hmm.
think everything that you're doing throughout your career prepares you for that next level. So to me, the things that we learned in the military, we could then use to apply to our civilian jobs, whether it's structure, organization, standardization. I think all of those things you can then apply to another job.
Mm-hmm. Yeah. And there's always different phases in life. Then there's that phase when you're just learning and you're a student, and then you have your job, and there's always these different phases. And at that point, you were in a very fast-paced environment. You were in the Air Force. And so I was wondering, do you ever miss that phase of your life? Because right now you're in a completely different phase. I'm assuming it's a lot more calmer right now.
It is. It is. I think when you leave one job and you go into another, the one thing that you really miss are the people that you've worked with along the way. And
Hmm.
so many of those people that I worked with back in the Air Force, I still have contact with them today. And I think even as you go from one job to the next. I think it's really more about the people rather
Mhm.
than just the job itself.
Yeah. Yeah. And as someone who has likely mentored so many people in your career, what advice would you give to younger professionals who aspire to have a role in healthcare or even in the US military health system, or even just someone who wants to improve their leadership skills?
I think number one, get those clinical or those technical skills, whether it's an administrator or a nurse or whatever your job, get those technical skills down. And then just do a good job in the job that you're in. Um, you're not, don't worry about titles, don't worry about promotions. If you're not getting that promotion, it's probably because you're not ready yet. And if you promote too soon, you're going to miss some of those development steps along the way. And so I think that's really important. I think it's important to not forget where you came from as you go through that. And then I would say know your know your priorities. So for me, faith, family, friends.
Hmm.
You want to go through that because when the job's not there, that's what's gonna still be
Yeah.
um, there. And
Mhm.
so, but I think at any job, just do the best job at the job you're at, and I think that will come. And then the other thing I would say to somebody just starting out is find a mentor and find somebody that is in a job that you aspire to be,
Mhm.
wherever they are, and then just find out how they got there. And then most people are going to, most leaders are going to help you through that. Our role as senior leaders is to develop the next generation or the next leader.
Yeah.
And don't be afraid to reach out to those senior leaders and ask for that input. I think so many times people think, oh, they're too busy or they're too that. And
Hmm.
I think it's really important, just like you're doing. I think I really admire that you're reaching out and asking and learning because I think as you go through and you start whether it's college or whatever you're doing, there'll be somebody there to help you through that. And so I would say also just find a mentor of somebody that you can just meet with periodically and find out what to do to get into that job.
Yeah, thank you so much. It was inspiring me. It was inspiring for me as well to learn about your experiences and how I think you had so many different titles and roles, but I'm glad that you emphasized that it wasn't just about getting that promotion. And I think you really emphasized that it was about the lessons you learned and the growth you had um, through these different titles and promotions. But I really enjoyed speaking with you today and learning more about your experiences. So thank you so much for taking the time to interview with me.
Thank you and good luck.